Our presentation is on the dangers of sleep apnea. So, our article was talking about a common misconception that sleep apnea is, in fact, not a dangerous condition. Uh, while this may partially be true, it is also quite dangerous to believe so. Sleep apnea is a condition in where breathing is interrupted during sleep. Uh, as the body wakes up, if it's not getting enough oxygen while sleeping, it's impossible to die directly from this condition, although with complications, it is possible. Some of these complications include heart attacks and strokes, and are often fatal. Living with sleep apnea for more than 5 years does increase your risk of heart attack by 30%, and approximately 22 million Americans suffer from this condition, with around 38,000 dying every year. However, most cases are undiagnosed due to the symptoms being easily dismissible, such as snoring, daytime fatigue, and awakening with a dry mouth or headache being ignored.
Risk factors include being male, overweight, 40, having a large neck, tonsils or tongue, family history, or nasal obstructions. Sleep apnea can lead to high blood pressure, diabetes, depression, poor performance in everyday activities, and worsening of ADHD. Sleep apnea is tested through a polysomnogram. Sleep apnea can be treated by losing weight, changing sleep positions, and avoiding alcohol. A mask may also be placed over the face to send air into the nose.
So the causes of sleep apnea includes three main things: the substance abuse, the blockage of airways, and the genetics. So substance abuse includes like alcohol, drugs, smoking. The small airways, which restricts oxygen to the bloodstream, can be caused by large adenoids, small airways, and there can also be some genetics, like in family history. Maybe someone from the past life has gotten sleep apnea and it passed down. And males also have a higher risk of getting sleep apnea.
Mouse due to similar causes. Morning headaches, difficulty staying awake, also known as insomnia, excessive daytime sleepiness, also known as hypersomnia, difficulty paying attention while awake, and irritability.
All right. In terms of treatment for sleep apnea, the most common way of monitoring and getting data about what specific type of sleep apnea that someone has and how to best treat it, they're often given a sleep study in order to help, again, gather data about their specific type of sleep apnea, which is then used to help find a specific type of treatment. However, the most common type of treatment for the obstructive sleep apnea is the CPAP machine, or the continuous positive airway pressure device. The CPAP is a mask that will gently blow air into the airways, which will open it, subsequently causing the previous obstruction to be essentially nullified. All right, this is a diagram of obstructive sleep apnea. As you can see, the most common type uh, and is usually caused by the tongue essentially moving backwards to create an obstruction or a blockage in the airway through which people are not able to breathe. This is either caused by gravity or some other factors, as stated earlier, such as genetics, um, other significant impacts to the airway, such as smoking or other drug abuse. And this is also why people tend to wake up, because once the airway is essentially blocked, there is no way for air to get into the lungs and oxygenate the blood, which will then alert the body that something is wrong and wake them up.